Most people severely burned in the Whakaari White Island tragedy don't know yet what has happened to them. A week on, 14 patients remain in burns units around the country, 8 of them in Middlemore. Plastic surgery consultant Michelle Locke says there is many weeks of work ahead.
The first time that a patient with burns goes to theatre, it is to clean them, to assess the limit of their burns, and certainly to start removing the burn wound. We call that debridement. And so to start with, the surgeries are to debride them and remove any of the burnt tissue. And then the rest of their surgeries after that are to reconstruct them and to perform skin grafting to reconstruct their skin. But some of the challenges we have with the major burns is that they don't have enough unburnt skin for us to graft them straight away. So you can take the amount of unburnt skin and place it in an area of their body, but there'll be large areas that we can't graft straight away. And so we have to use dressing products or, in many cases, cadaver skin to cover those areas. You may have heard that we've ordered in millions of dollars worth of cadaver skin from overseas, and that's why, because we need it for the major burns where we can't cover them with their own skin in the first instance.
So is that a temporary measure, and how long can you do that for?
Yes, so the cadaver skin is only temporary because it's not matched to the patient. So in the same way you couldn't do an organ donation to someone who wasn't matched to you, you can't put someone else's skin on it and leave it on forever. But in the burn situation, we use that cadaver skin almost as a biological dressing, and it usually will stay in place for up to 2 weeks. And it keeps that area dressed and healthy. And then we would remove it, and if we needed to, replace it with fresh cadaver skin. Or if they've got areas of unburnt skin that have healed, we can harvest the skin from that again and do some more grafting.
How long does it take your own skin to grow?
Where we harvest the skin from, we would call it the donor site, that area takes about 10 days to 2 weeks to heal up. And it would be quite normal in a major burn for us to harvest that area multiple times and let it heal and then harvest it again, let it heal, harvest it again.
So in terms of the patients that you're dealing with, will some of them have been in theatre every single day?
Probably not every single day. It would be more normal for people to come back perhaps every other day. So there are a couple of the larger burns that have been most days, but what we'll often do is spend the whole day on one person in the theatre, do as much work with them as we can, do as much grafting as we can, dress them well, and then it may be 2, 3, 4 days before they need to come back again.
So when you
But the amount of hours they spend in theatre, each time can be the whole day just on one patient.
So what do you mean by the whole day? 8 hours, 10 hours?
It takes as long as it takes, Lisa.
So hours and hours.
Many hours. So our normal operating day would be 8:30 in the morning to 4:30 at night, but with these sorts of cases, our theatres have routinely been running late, and we've often been operating till 9, 10 or 11 o'clock at night.
So obviously your skin normally, it regulates your temperature. You know, we sweat and you cool yourself and it helps warm us. How do you deal with that in a patient who has lost so much skin that the body's not able to regulate itself? Are they in warm temperatures at the hospital, or how does it work?
That's a great question, Lisa. Yes, they are kept very warm. The rooms are kept warm, and particularly the operating room, because when we take them to the operating theatre and take their dressings off, it does expose them and they can't regulate their temperature. So the operating theatre is routinely kept at around 32 degrees. So that way the patient doesn't cool down so much while we're doing their surgery and their dressing changes.
So you're in all your surgical gear. Sorry to interrupt. You're in all your surgical gear in the 32 degrees operating theatre. You would be sort of gowned up with all your gloves, etc. on during that time.
That's correct. So I'll be wearing scrubs, and then we'd have impervious gowns, gloves, hats, masks over the top, operating in 32 degrees. That's correct.
Are these patients well enough to realise the severity of their injuries at the moment, any of them?
Most of them are not. Of the 8 burns that we have at Middlemore, 5 of them are still in a critical condition. Many of them are still intubated and ventilated in our intensive care unit. So at the moment, many of them have not yet woken up.
Also, exposed areas of your body, like your hands, obviously, with, fingers are very intricate and they're moving parts of the body. Is that a specialist area, or how do you deal with things like hands?
Yes, our burn surgeons are trained to deal with all areas of the body, but certainly areas like the hands and the face we consider to be special areas, and it may be that we do the grafting slightly differently in those areas. We would put a sheet graft on where you just lay on the sheet of skin rather than meshing the skin to try and spread it and cover more area, so that we get a better cosmetic result as well from those areas. But our burn surgeons are trained in dealing with all of those special areas regardless of the type of burn injury.
And so in between those surgeries, how are they cared for? Because I'm imagining, well, you want to stop the skin tightening or drying out, or?
Yes, so that's what the dressings do. So each of the burnt areas are dressed with multiple layers of dressings. There's some dressings with, for example, like a paraffin oil beside the skin so that the skin doesn't dry out, and then layers of wet dressings that may have antibiotics or antimicrobials in them, and then drier dressings with padding to absorb any fluid that comes out of them. So when we're putting dressings on, they're usually multiple layers of different types of dressing, and that's what we use to keep the wounds moist and to absorb any fluid coming from them in between dressing changes.
And how often would the dressings be changed?
Every 2 to 3 days on average, although if we've done some skin grafting, we might leave it a little longer, perhaps 4 or 5 days, to give the graft a good chance to take before we change the dressing in that area.
So this is all incredibly labour-intensive, delicate work then?
You're absolutely right. So it is a lot of hard work, and when we have been running our burns theatres, we've been trying to staff each theatre with 4 doctors, which might be 2 consultant burn surgeons or plastic surgeons and 2 of our registrars or junior doctors helping out. And so you can imagine the amount of work we have to run those theatres, 4 theatres a day, because as well as the doctors, there's the same number of nursing staff in there. There might be 2 anaesthetists and an anaesthetic tech for every burns theatre that we run. So the amount of staff just in one burns theatre is really incredible. And then there's the workload on the ward, looking after the patients between their theatre times in our intensive care unit and the National Burns Unit. The nursing staff do an incredible job looking after them there, but it's very labour intensive.
And can family visit them on the wards?
Yes, we welcome family visitors.
I'm just more meaning in terms of infection and exposure to other people. Just wondering how that works.
So the National Burns Centre has individual rooms with, we call it an antechamber, which is a room that you go into so that they're all appropriately air pressured to prevent infections, and we ask any visitors to cover up. We have gowns and gloves that we expect people to put on before they go into the room. So we do try and prevent infection in that way, but yes, visitors can come.
So tell me, are these burns materially different to, say, a burn someone would suffer in a fire? Do they look different? Do they react different?